Hello, everyone. My name is Ivailo, and I'll be your host for today. Welcome to this fantastic in-event talk about growing attention to mental health. We are here once again with an incredible guest we previously had, Christy Lamka, Chief Operating Officer at Thrive 360. Hi,
Hello.
Christy.
Hi, nice to be here
So,
again.
yeah, very good to have you. I'm super excited for today's talk as well.
Yeah,
Um,
music.
so Yeah, a little bit of information for our attendees today of what Thrive 360 is about. It's an on-demand digital platform that is medically and scientifically driven. Sessions are produced by practicing professionals using proven tools and techniques with a wide range of session topics addressing life's issues. Thrive 360's marketplace can address any challenges employees face on any connected device. The mission of Thrive 360 is to provide access to affordable and effective mental and physical healthcare solutions for all on demand. That's about right, Christy?
That's about right.
Awesome.
Yes.
Awesome. Well, before we move on with the questions, just a little bit of intro of what we're going to talk about today. By and large, physical health is still more straightforward and often more tangible than mental health. But over the course of the past decade, there's been increased willingness to recognize mental health as an essential part of one's well being. After centuries of shame and misinterpretation, the term mental health is losing the stigma. Historically, when people have talked about mental health, they usually meant severe mental illness. Dr. Mark Van Omeren, if I'm pronouncing this correct, a mental health expert who works with the World Health Organization, tells NBC News better. Today, mental health can also mean common conditions like anxiety and depression. In more places, though it depends on where you are, people understand mental health simply as an aspect of overall health. Our awareness is shifting and mental health is coming out of the shadows. Very, very, very important. Very well said. I totally agree with everything. I'm sure you do too. And now I suggest we start digging, and maybe you share some of the insights. I'm sure the audience is looking forward to all of that. Maybe the first question, as a natural, sequel of of the intro we just had, is what are the current trends in mental health? If you can break this down for us a little bit.
Yeah, I'm happy to touch on that. I'm going to talk about how we're shifting more towards more awareness of mental health. Before I get to that, though, let me just kind of touch on the trends we're seeing both globally and here in America of what mental health is looking like. So,
Mm,
first of all, we see from the World Health Organization, they came out with these trends of global mental health in 2019, so before the pandemic. Nearly a billion people were living with a mental disorder. A large chunk of those were adolescents. Suicide accounted for 1% of all deaths, which is pretty significant. That's globally, again. And mental disorders are the leading cause of disability, causing 1 in 6 years lived with disability. So we see on a global scale, mental health, again, this is in 2019, was pretty significant. People were dealing with
mm,
a lot back in even 2019. Of course, you'll see that that has grown since the pandemic hit and everything else that's come since then. So now we're shifting towards America. This was from Mental Health America in 2022. Looking at the trends over the last few years, since 2011, both the rate of suicidal ideation has increased every single year since 2011, and the percent of adults who had an unmet need for treatment has increased every single year. So, again, we're seeing that people since 2011 are dealing with these thoughts, dealing with mental
mm.
health issues, and yet every year more and more people aren't being treated for it. So both of these trends increasing since 2011, I think is quite alarming. I think that you
Oh
probably
yeah.
agree with that, we're not seeing any any help in these areas where people aren't, able to get the treatment that they need. And
Mm,
so if we look at the Stress in America survey, this is of 2022. So these are the latest statistics on stress. We see that things like inflation, supply chain issues, the uncertainty in the world, and then all of the issues right now going on with Russia and the Ukraine and war happening around the world are causing significant levels of stress here in
mm,
America. Again, this is just the American statistics. I can only imagine what it's like globally. Obviously, probably a lot more than this. And we
yeah.
also see that stress about money and the economy is on the rise as well. So stress about money is the highest since 2015. So again, these things aren't slowing down. Thoughts about what we've seen now is thoughts about suicide, thoughts about uncertainty, stress about money. All of these things are just getting worse. And unfortunately, people aren't being given the tools to address them and to deal with these issues. And so,
Mm,
because of that, people are then resorting to unhealthy ways of coping. So, what we see is since the pandemic, people have had undesired weight changes. So, we see a lot of times that stress causes overeating or maybe unhealthy eating. People like to resort to emotional eating at times to help with stress. And people have been drinking more alcohol since 2019 to help cope with that stress as well. So, again, if people aren't given the tools to deal with issues that they have, they're just going to get into those old ways, those bad habits, and cope with those issues in an unhealthy way, which again just creates this vicious cycle, right? Where people
right.
are are having these unhealthy habits and can't get out of them because of the stress that they continue to experience. Um,
Mm,
so, one last slide I'll show on the data on mental health. This is 2022 data. This is everything from the National Alliance on Mental Illness that has come out in 2022. So, again, this is the most recent, the most up to date data. What we've seen is that children that had COVID are actually more likely to experience an onset of mental health issues. In the study that was done, it was actually within 30 days of contracting COVID. Children oftentimes had mental health issues, and we saw that they were more likely to experience that within 30 days of getting COVID. So that's certainly something to keep in mind. Symptoms related to eating disorders has increased since the beginning of the pandemic. Again, this is something that's not entirely surprising. I think, people are stuck at home, they're not able to go on with their regular routines. It's kind of hard to deal with those intrusive thoughts of, you know, maybe that's bulimia or anorexia or whatever that eating disorder might be. People were having more symptoms related to those troubles because of the pandemic.
mm,
Also, postpartum depression levels and associated risk factors increased due to the pandemic as well. Again, just environment changing. And what this study saw too is a large chunk of that was in relation to stress regarding worry about contracting COVID or the child contracting COVID. So that led to higher risk of depression in postpartum. And then lastly, the pandemic is linked with inflammatory brain markers and mood changes, even in people who didn't test positive. So this isn't a piece of data that came from people who, they tested positive and we saw that that led to these inflammatory brain markers. This is across the board, whether you contracted COVID or not, just being alive in the time that COVID existed caused these changes. And so it is still so early, it is still so soon since COVID began that we don't know the long term effects, but this is what we've
mm.
seen in 2022.
Yeah. I guess we're just living in such stressful times, and I
Yeah.
guess media and external influence from people, from articles, from webinars like that, from trends, from publications play a huge role when it comes to what you think, how you perceive something, what your state is, and that reflects on your mindset, on your mental health as well. So the more you think about it, the more vulnerable you become, because most of the things out there on the media are all like negative and not very positive thoughts out there, but people
That's
should be aware of what's happening. So
yeah. Yeah, and I mean, I hate to be a part of that negative media right now, sharing these negative statistics. But I mean, you're exactly right. People need to be aware of what's going on, but I think also providing that escape and providing those coping mechanisms is
mm,
so vital and so important for people to know how to get past those feelings. Get past that stress and deal with it.
definitely, yeah, bring that awareness that people need. So
Yeah.
speaking of which, and how people are looking for help or accessing help,
Yeah.
what is the data showing regarding people accessing help?
Yeah, well, okay, I'll show you. So, 150 million people live in mental health professional shortage areas in America. Again, this is America specifically. We have a huge supply and demand issue with therapists. You might recall from my last talk with you all that there's only 30 mental health professionals for every 100,000 people in America. So that's pretty significant. And if you look at this map here, this shows how many people are sharing just one mental health doctor. And so the red is showing over 10,000 people that are sharing only one doctor. That's remarkable in
Wow.
a bad way, of course, that people just don't have the access that they need. There aren't enough providers out there, and the providers that are out there are completely burned out. We have 46% of mental health therapists today say that they're burned out. So again, even the ones that are able to see patients, you can only see so many in a week. So there's a
Mm,
clear supply and demand issue. And so people aren't able to get the help that they need, and they don't really rush to do it. As we see on the stat on the right, that the average delay between onset of mental illness symptoms and treatment is 11 years. So 11 years it's taking people from when they first start to experience these concerns and these feelings to actually get in front of a provider and get help. It's taking 11 years.
that's a
So
lot. It should
that
take
is
11 days, which is impossible, but I guess 11 weeks is very
right.
reasonable. 11 years is
11
ridiculous,
years.
but
I agree completely. And so, I mean, I think it's become clear in recent years how much needs to change to get
mm,
access to people quicker. So, again, with this supply and demand shortage, there aren't enough providers, but a lot of alternatives are coming out where people, maybe don't need to go see a therapist in person. We'll talk about our platform in a little bit that helps with that. But, I think that the whole system is kind of recognizing this issue and shifting a little bit to address this concern. But
mhm.
also, of adults who did receive mental health services in 2020, 17.7 million had delays or cancellations in appointments. So if people were dealing with a significant concern, having those delays or cancellations, that can be really detrimental to their mental health and their well-being. If they're feeling anxious already, if they're dealing with a significant concern
Mm,
already, and then they have delays, that just kind of exacerbates the problem. And then nearly 5 million were unable to access care at all in 2020. So this is from
oh,
the National Alliance on Mental Illness in 2020, what we saw. And then
yeah.
lastly, I think I've shared one of these slides before, but 8 out of 10 employees with mental health conditions in 2019 said that shame and embarrassment prevented them from seeking treatment. Now, that is an enormous unmet need of people who feel that stigma. They don't want to talk about the issues that they're dealing with. They don't want to bare their soul discussing what might be bothering them. And so, because of that shame and embarrassment, they just did not seek help. Again, this is
Mm,
2019. 2019, so we're seeing some improvement in this particular statistic. But, you know, 8 out of 10 people not being able to get help simply because of stigma shows a societal issue, right? And then on the other end, 6 out of 10 adults with mental illness just don't receive care. So that's in 2020. Again, I showed that it is increasing since 2019 and 2020. These things
Hmm.
are improving as we notice what an unmet need that there is. But these two statistics were just very eye opening for me and for us as a company, seeing this enormous group of people who just aren't being spoken to. These people
Hmm.
aren't being helped in a way that works for them.
Hmm. Right. Yeah, I really hope we see like a lot of improvement when it comes to the numbers in the upcoming years, and that becomes like a part, like a default part of every system out there, be it school, be it work, and so on. And we see that with a lot of the big companies and a lot of the education facilities and centers out there. But I really hope that that improves quite a lot over the years, and I'm sure it will, because we are bringing
Yeah,
more and more awareness to that as a
right.
problem than the realization that people get from it and so on. So this is
Yeah.
super super important. I agree.
Yeah, absolutely. I think it will improve. I think it just, takes really looking at these numbers and doing something about it. Because I think that it's become very clear in recent years that um, there's a problem, there's a shortage of help, and there's a lot of people who need help. So something has to be done, right?
Definitely, definitely, totally agree with that. So when we talk about this, what has helped to advance our awareness of mental health as an integral part of
Yeah.
overall health on a global scale, on a global level?
Yeah, so unfortunately, one thing that has helped advance our attention of mental health is just the prevalence of it. So it has increased so much in recent years. And like I showed in previous slides, has increased since 2011 that, you know, it's currently too big to ignore. So there are so many people who are dealing with these issues that it's hard to ignore it now, which is a good thing in a way. It's good that people are noticing this need. I think probably everyone knows someone who has dealt with some level of mental illness. So
Hmm.
on one end, there's that has kind of increased our attention. On the other end too, there is a rise in celebrities or influencers talking about mental health, which there have been a number of studies done showing the positive effects of that. So the more that people in the spotlight are able to talk about their own struggles, talk about the fact that they needed help themselves, that has led to people being more open to mental health resources. So that is a good thing, especially in recent years. So, thinking about Simone Biles at the Olympics, that was very public. That was a very public display of recognizing that she needed mental health support. And so that kind of brought that to the minds of everyone else, realizing, like, okay, if this is something that this person can do, maybe I can too. And we're seeing mental health shown in mainstream media as well, so in TV shows and movies, kind of mentioning it and helping to remove that stigma. So all of these things where people are bringing it to the forefront, people are talking about it more. That is really helping reduce that stigma and getting more people to access help.
Definitely, yeah. I really like what you said about the influence of these social media influencers out there that are doing ads for various things, but not the actual problems out there. And seeing people actually embrace that these kind of initiatives and just speaking about it to the broad audience, the followers they have, is super important and very very nice from their end, even if they don't have to do it, even if they haven't faced this themselves. It's still important to bring it out there and to bring awareness to it.
Absolutely. It creates that sense of community, even with people that you don't know, understanding that, okay, there is someone else out there who understands what I'm going through, appreciates what I'm going through, and
Yeah.
recognizes when you need help.
Exactly. And we actually did a poll for the audience. I'll share the results once you add just what your opinion is on the following question. But
Yeah.
we touched on this a little bit so far. But do you consider that mental illness has not yet been normalized as a physical illness?
Yes, absolutely. And what's interesting about that is how much mental illness affects your physical illness and vice versa. Both of those things kind of go hand in hand. And I have a slide that talks to this. But essentially, things like depression actually increase your likelihood of getting cardiovascular disease, metabolic disease, just by having depression. And stress also leads to a lot of different concerns as well, from trouble sleeping to digestive issues. I remember when
Mm,
I was a kid, on the first day of school, every year I would feel sick. I'd be nauseous going to school every year because I was nervous, and I think we've all felt that sometimes when we're nervous, that you feel that digestive reaction to it. So
for
I think
sure.
the mental health and physical health goes so hand in hand that they need to be treated the same way, but in a lot of ways they aren't yet.
Yeah, I have that as well for like public events, like even this one. But it's that it's a positive kind of anxiety because we here that are trying to delivering a message want to make the most of it for the broad audience because that message is important, and we want to convey it properly to the people, to everyone who's listening. So I think
Exactly.
that kind of anxiety is good to have. That means that you care about this, like genuinely care about this, and people
Right.
see that.
Yeah, absolutely. That's certainly true. But yeah, I mean, for some people that gets to an extreme level, right, where it's
Yeah.
debilitating, or things like social anxiety because of um, worrying about how they're being perceived. So
Mhm.
there's levels to everything, and I absolutely agree.
Definitely. Yeah. Um, so my next question, and I guess people would also be interested in, why should people care about their mental health, and why should companies specifically ensure the welfare of their employees in this regard? I think
Yeah,
that's super important.
absolutely. So, I mean, for people to care about their mental health, again, mental health is just a part of your health. So, it's very important that you take it seriously, that you listen to your body and your mind when you're dealing with certain feelings, and finding healthy ways to cope with them so that those issues don't increase, so that the issues don't exacerbate over time and turn into something worse. So, anytime you're dealing with a certain level of stress, if you just let that keep going, that's when it turns into physical health problems. It can increase into more serious levels of anxiety. So, it is important to get those at the beginning, to address those needs as soon as they arise, and preferably even before. If you can start incorporating certain mental health practices into your regular routine, then you'll just be more healthy. But from an
Mhm.
employer standpoint, the reason why I would say that employers need to kind of take more of the initiative is just because we do spend so much of our time at work. So the majority
Mhm.
of people spend the majority of their time working during the week. And so because of that, that environment that's created at the workplace, whether that's in person or whether it's remote, there is a culture that goes along with every organization. And that not only permeates into the mental health of the employees, but also into the health of the organization itself. So we
Mhm.
see that when employees are more mentally healthy, when they're able to focus and calm their minds, that relates to higher productivity, lower turnover levels, which we know has been a big issue in recent years, that turnover has been pretty significant, and then lower absenteeism and healthcare costs as well. So it not only benefits the organization to create a mentally healthy workplace, but it
Mm.
benefits the company as well. So really, it's a win-win. We don't see why there's any reason not to address this significant issue that's happening, especially
Mm.
when it just helps everyone to do so.
Yeah, definitely. I can see on the chat, our participants in today's webinar are just discussing like how important this is, and for example, Bukola shares that in Africa it's misunderstood for being mad. How that may lead to suicide, which is very very unfortunate. So this brings us back to how important it is to uh, that realization that it's all normal and it's a part of today's world, and we need to
Right.
take measures as for everything else that we have on a day-to-day basis in our lives.
Yeah.
But we also have one question from Daniel Ferrero
Mhm.
that asks you to talk about a little bit the lack of recognition from insurance providers of mental health as preventative care.
Yeah. Okay. This is a fantastic question. So when I was doing my research for this webinar, actually, I was seeing a lot about this particular point that insurance, while it is improving, they are offering more resources like telehealth, telepsychiatry today. A lot of insurance providers don't cover as much mental health care as they might for a physical illness, and
Mm,
especially for preventative. So, I mean, that's a fantastic point that I don't think that there has been enough research to date that really proves how much addressing mental health at the beginning can lead to better outcomes from an insurance carrier standpoint with regard to healthcare costs. And so that's why I think for them, unfortunately, and I hate to say this, but a lot of it does go down to the ROI, and it goes down to what's in it
mm,
for them as a company to address it up front. And so some of the things that we're doing at Thrive 360 is we're doing clinical trials to prove this exact point, how much mental health and physical health are correlated. So we have a study right now going on for hypertension, which is raised blood pressure. And, if we're able to use mental health interventions to reduce blood pressure, that is a very clear ROI for insurance carriers. So I think, for all companies across the board trying to address this issue, and there are a lot who are trying to help mental health, making sure that you do those studies and you get the data to show these insurance providers how important it is to mitigate the concerns at the beginning before it exacerbates too far. That's something that I think in recent years we'll see a lot more of.
mm. I sure hope so, because that would lead the way for a new trend out there for insurance providers, because it has that noble element to it, and people would like to take part of, or to be part of companies that offer that kind of services, not
Absolutely.
just for the sole reason of having it available. So
Exactly.
I'm sure that would open up this new trend and this new initiative, and make it an inseparable part of every insurance provider benefit or offerings. So
Absolutely. I mean, they ask you to do yearly physicals. Why not do a yearly mental health physical, right? And address your mental health and your well being. I
mm,
wonder what that would do to improve people's overall well being.
mm, exactly. Yeah. So my next question is, what is the most important step we can take to advance mental health care?
Yeah, I mean, it's a hard question because there's so many from so many different levels. So,
Mm,
from an individual standpoint, I think, like I said before, just taking it seriously. So, understanding what your body needs, what your mind needs, and not waiting until it gets to be too serious. So, addressing those any feelings that you have up front and really making mental health part of your regular routine. That's something that you can do from an individual standpoint to just improve your own mental well-being and those around you, in relation, of course. And then from a company standpoint, of course, like I said before, making sure that you give your employees something that helps them and is built for them. A lot of the resources that have traditionally been made available just aren't utilized because they're not built in a way that truly addresses the need and truly addresses the barriers that people have to access. So, from a company standpoint, making sure that you're not just checking the box, like unfortunately a lot of companies do. They say, well, oh, we have this resource, it's available, people don't use it, but it's there. Instead of finding something that truly works and truly makes an impact on their employees, that's something that companies can do. And then, on a society and global basis, just continuing to keep mental health a part of the conversation. So, not being ashamed to talk about it, not being afraid to mention when you're dealing with these concerns. Like I said, all of the studies that have looked at, all the ones that I've seen at least, that have looked at people talking about mental health, especially from celebrities and in the media, has only led to greater outcomes of people seeking help. So making sure that that stays a part of the conversation is certainly an
Mm.
important thing that we can do.
Yeah, very, very important. I totally agree. And we have one other question from the audience, which is, I think, a great one, and it would be great if you can expand on that a little bit. It's from Tembeka. Hi, Christy. Can you tell us a little more about signs to look out for in terms of mental health issues in kids, for example, kids from divorced families or school uh, going kids, etc. So, just for
Yeah.
signs.
Yeah, absolutely. So, um, things to look out for in general are anything that is a deviation from the norm. So, if your kid generally sleeps, from 10 to 7, I'm just coming up with random numbers, but they all of the sudden shift their sleeping routine, for example, where they're sleeping a lot or sleeping a little. That's certainly a
Mm,
concern for mental health. If you're seeing deviations in their eating habits as well, again, maybe they're eating too much, eating too little, that can show a concern. And then any significant changes in behavior, that normally correlates to an underlying mental health issue. So those different things, if you're noticing, again, a lot of changes happening with that person, it might be time to have a conversation with them or take them to a mental health provider to see what might be going on that's causing those changes.
mm. Yeah, that's very important. I think we need to also build that awareness for other people taking care of kids or people in need, generally speaking, so they can recognize this, as well as people supporting other people for work, just being
Yeah,
there to assist them with their day-to-day responsibilities or their life, generally speaking, if there is a disability involved and so on. So I think that should also be part of part of this initiative and this movement to bring better awareness.
yeah,
um yeah, well, definitely a great discussion. We're almost out of time, but I have a few questions more that I think would be super helpful for our audience. And I think they're also very involved in what we're discussing, as this is a huge, huge topic nowadays. It's important to learn more about it and be better educated. Um, and I know most of those who need help will never seek it. We talked about
right.
this. So paralyzed by this embarrassment, 8 out of 10 people, as you said, who need emotional therapy refuse to seek it.
Yeah.
How did you manage to build something that makes it easier and more comfortable for people to access and participate in therapy?
Yeah, absolutely. So I'm going to pull up some more slides to this point, but essentially what we did is we looked at these barriers. So we did a lot of research on what exactly was stopping people from seeking help. And if you'll excuse me, I'm going to skip ahead to the slide that we're on. But we looked at why people weren't accessing care. And so a part of that was that 8 out of 10 who were feeling that shame and embarrassment. It was the lack of providers. So
Mm,
the supply and demand issue that I mentioned before, and people just not having the time and money to address the concern. So right now, it takes anywhere from 25 to 90 days to get in front of a therapist once you reach out for help. And once you do get in front of that therapist, it generally takes 15 to 20 appointments to make a measurable impact. And if each of those appointments is, up to $200, a lot of people don't have the financial
Mm,
means to address every issue as it arises. So,
mm,
what we did is we engineered a platform that removes those barriers to access to make it easier for people to engage. So, we made it 100% anonymous and confidential. So, people don't have to worry about that stigma component. Everything on the platform is completely anonymous. It's accessible 24/7 on anything with a screen, from your computer, tablet, phone, to a virtual reality headset as well, to make a more immersive experience. And if you have an issue
mm,
at 2 a.m. on the weekend, you don't have to wait until Monday morning to see when you can reach out for help. You can just pull up the tools and support right then and there. And
mm,
lastly, something that is really unique to us is that there's no two-way interaction needed. So you don't have to, answer a bunch of questions or feel uncomfortable talking about the issues that you're dealing with. You can pull up a Thrive 360 session and, get that support from a practicing healthcare professional who has dealt with this issue from someone else before and knows how to address it. So we call that self-service as a first step. Now, we're not trying to replace therapy. We absolutely see the need for a lot of people to go see a professional, either in person or via telehealth. But with the barriers, with the supply and demand issue, this is a fantastic way to get help immediately for whatever issue arises. So we have
mm.
about 650 topics that we address, with various types of therapy that we utilize as well. So we know that
Wow.
mental health is not a one size fits all. So whether it's cognitive behavioral therapy, whether it's clinical hypnotherapy, we have everything that you might need to see what works for you. You can try out
Mm.
different modalities to find what resonates best with your own mind.
Wow, that's super impressive, and that exactly takes that element of embarrassment for
Yeah.
people, and it might just broaden their knowledge about what the possible reasons for their status is, for their current state is, so they can explore this later on.
Yeah.
Otherwise, not knowing about that makes you feel a little bit calmer and not take any. If that sounds a little bit ridiculous, let me
I
know,
know.
but I think I've had that before. Not knowing just makes me feel a little better, a little calmer, but
Yeah.
that doesn't work in all of the cases.
In the
So
long
I,
run. Yeah.
in the long run, for sure, and definitely if there is something serious involved. So I definitely agree that that's super super important, what
Yeah.
you guys have done. Nice. Well, do you have any tips that people can do if they're dealing with their own mental and emotional issues? I guess we all are in a way, so I think we would appreciate some tips if you have.
Yeah, absolutely. So I'll start with some general tips and then I'll talk about kind of how we at Thrive 360 can help with these tips.
Hmm.
So, eating and drinking healthy is really important. Again, the mind and body are connected. Getting regular sleep and exercise, moving your body, even if you might have certain constraints, you can't, do full on exercises. Just movement is helpful for your mental health. Practicing gratitude really helps get your mindset into the right state to, have gratitude and appreciate what you have. Finding coping mechanisms to relax and de-stress. I talked about this before. A lot of people have unhealthy ways of coping. So finding a healthy way of coping to help you relax when you're feeling, stress or anxiety is important. Being able to reframe any negative thoughts you have and be positive, setting goals and priorities, and then creating a community around you and having some type of connection is important as well. So, not having to always go it alone, having friends and family
Mm,
around you is important. And so, like I said, I'll talk about how we can help with this too. Thrive 360 does have, again, this was created by the National Institute of Mental Health. They listed off these tips, and Thrive
hmm
360 has a session to address every single one of these. So I'll click through and touch on what they are. So For eating
Sure.
and drinking healthy, we have, this session that helps you recognize how to eat in a balanced way. We have sleep sessions. This is a session called Sleep Better. We have many sleep sessions, not just this one. Exercise. We do have movement sessions on the site. So here's one, Promoting Health Through Movement, that I really love, by Dr. Lori Bondino. And practicing gratitude. We have a session called Attitude to Gratitude, which I just love that title. And that's by Dr. Deborah Mandel, that helps you to have more gratitude. Finding coping mechanisms to relax and de-stress. We have this session called Relaxation to Reduce Stress. So basically addressing that exact thing, by Joanna Trevino. Being positive and reframing negative thoughts. We have a session called Positivity. This was actually our most popular session of 2020, so that kind of makes sense with the state of the world. We
Hmm.
also have sessions on goal setting and achieving goals. And lastly, there's a session called Resilience, Connecting to External Sources of Support, which talks exactly to that point of creating a network and a community that is supportive
Mm,
and helps you. So
mm.
these are just a few examples. There's hundreds of others, but I wanted to point out a few that you can take a look at for each of these tips that you can do.
Yeah, that all sounds great, and I love how you go back to the basics, because people don't realize how important any of this is. And I'm speaking from experience here. How sleeping better makes you feel better, how you get to appreciate the things around you and that you have, and not focus on what you are missing at the moment, on what you're lacking, and so on. And that's super important. And recently I found out how much of a negative impact has coffee on even if that sounds ridiculous. I mean, it's definitely there, because it's not a narcotic in a way, but something that people get addicted to, which
Sure.
disrupts the sleep, definitely.
Yeah.
So coming back to that, and improving all of these factors will definitely have a huge positive impact on mental health, as well as having someone that just knows what this is about and has dealt with it before. Professionals like you guys is also extremely, extremely important.
Yeah, I mean, just making it a part of your routine, just making mental health a
Mm,
priority is so important. Just kind of incorporating it and being mindful about your own well-being. It really does make an impact on everything, on your relationships, on work, on your whole life. So making that a part of your life is so important.
totally agree. Totally agree with that. And maybe we can end with we're a little bit over what we had
Yeah.
planned, but it's it's a great discussion going on, and I see that the audience appreciate that as well. So we keep on going. But maybe the last question that I have, I think is super important to discuss, is how can we step up our prevention and mitigation game?
Yeah. Okay. So I've said it a few times. I'll say it again. I'll say it forever, that just making sure that you make mental health a priority from every standpoint, not waiting until whatever issue you're dealing with gets to be super severe and super serious before you admit that you might need help. And again, this doesn't necessarily mean that as soon as you feel stress, you go see a therapist every time. I know that that's not realistic for a lot of people, but finding those coping mechanisms, finding different ways that you can deal with the issues that you have at the beginning before they rise to higher levels of stress, higher levels of anxiety, finding those ways of coping that work for you is something that you should look at. Not you, but everyone should look at now. Find what works for you, and then you can use that as maybe more serious issues arise, and recognizing
Mm,
when you do need to actually reach out for help.
mm. I see what effect has our discussion on people realizing, appreciating, giving love to what we're discussing, which is what's expected from everyone out there. So if we can scale this to a million times, that will be super helpful. We might as well resolve what we have as an issue today.
Right.
Uh, yeah, but super super insightful. I hope these talks and viewpoints are helpful for any who is struggling out there. Mental health issues are more common than we obviously think. So uh,
Mhm.
you are never alone in getting help, right?
Yep.
So everyone that's out there, just don't hesitate to reach out to the professionals if you want to discuss the future of mental health, what the means are to cope with that, and how you can improve your mental health overall.
Yep.
What a
Yeah.
great discussion and conversation, Christy. We just love having you here. It's the second time, hopefully not the last time. Um, uh, as I said, super super important to bring more awareness to that, and people are. It's great to see that people are open to that and are interested and find that insightful, and that's I think one of the most important things we have to do when it comes to mental health. Um,
Yep. Absolutely. I agree. And thank you for having me. Thank you everyone for being here. This is great. I'm sorry to go over time, but I'm very grateful to be here and
that
have this conversation.
we as well. That's totally fine. I think it was super helpful and super insightful for everyone. So even if it goes 30 minutes more, I'm sure people would be happy to be here and to listen. But maybe some other time we would love to have you anytime, of course.
Well, thanks. All right. Thanks
Thank
so
you
much.
guys. Thank you as well, Christy. We hope to see you at our next event talks. To the rest, bye bye, and hope you find this session and webinar helpful.